Thank you for kind introduction. In my next talk, I will speak about the newborn screening in Southeastern Europe and Western Balkans, which is also one of the regions of priority of Slovenian EU presidency. Southeastern Europe is comprised of around 14 or 15 countries in that region, with total of over 70 million people of population. 8 of these countries are part of the EU and some other are bordering EU. This region is very diverse in terms of economic development. Some countries are considered developed and some are still developing. And until recently, there were only scarce data available on existence of NBS programs in this region. We performed 2 survey studies in the past 10 years. One was performed in years 2013-2014, in 2020, and finished in 2021. We had aims to assess the situation regarding newborn screening in the region and to establish an informal group of involved professionals. These are the 2 resulting publications, which I will briefly present. So the number of diseases screened in 2013 was uniformly very low in the region. There was only 1 country with 3 or more diseases. Some of them had only 2 diseases, some 1 disease, and 2 countries had none of diseases included. But here we didn't include the Hungary and Greece in that survey. In 2020, the situation was much improved. 2 countries had more than 10 diseases in the MBS program. 3 countries had 3 to 10 diseases, but still there were 2 countries with none of diseases screened. The type of newborn screening in 2013 was almost uniformly basic one. But in the year 2020, more than 3 countries had expanded newborn screening programs with some additional pilot or institution-based programs also introduced. The proportion of newborn screened in the year 2013 was relatively low. Only 5 out of 13 countries had coverage rate of over 90% of population. But in the year 2020, the situation was much better. Now, some of the countries went over the 90% of coverage, and some others went over the 80% of coverage. And in 2020, most of the countries from the region had some plans to further expand the newborn screening program. So what were the main obstacles for further expansion of newborn screening? Most of the responders actually mentioned lack of financial resources, organizational aspects, lack of staff, lack of political will, and a bit less important was later management and small incidences of disorders to be potentially included. To conclude, the region of Southeastern Europe, Western Balkans is a very diverse one. Are still lagging behind of standards for NBS best practices as of year 2021. We noticed a modest degree of progress in the period 2013 to 2020. So more diseases were included in some countries, better coverages, and actually there were existing more expanded NBS programs, but perhaps that progress was a bit less than what was planned. We also assess the barriers perceived. Main ones are lack of finances, problem with organizational aspects of the program, lack of staff, lack of political will. So we would like to actually propose that there should be a strengthening of international and regional cooperation so that at least basic MBS infrastructure is present throughout the region, perhaps by sharing best practices models, by accommodating exchange of people and practices, by help with preparing applications for financing on the national level, and possibly the role of EU institutions could be increased. Thank you very much for attention.